with Dr. Darien, taking a look at an important topic that many of us have experienced. I'll speak for myself, bloating. So when should we worry about bloating? I hear about the broccoli and all of that other stuff.
Cruciferous vegetables, that'll be one point. But yes, this has gotten a little bit more than you would imagine over the weekend in terms of the headlines that you've seen. We've been seeing bloating, flatulence. I've been lucky enough to be tagged into many of these things. So that brings us
something about flatulence.
And for those at home, you can also tag Eva and DeMarco as well instead of me. But why does it happen? So that feeling of bloating, feeling distended, feeling like there's gas that you have to pass. Patients sometimes come in because it can be so unsettling and lasting for longer than they imagine. They want to know if they have an emergency. For the most part, it is not an emergency. Just to be clear,
it's gas.
It's often just secondary to other things. For example, digestive problems. As your body digests food, gas is created from the bacteria that live in your gut. Sometimes it can be hormone imbalances, and most often it's just simply excess gas, maybe eating too fast, drinking a carbonated beverage. So some things you can do to reduce that. Movement. Exercise helps with gut motility. That is why when I was in medical school, one thing we always had to do is get patients up and moving, making sure that they're passing gas, because that was a sign of good health. And if those who are asking questions, the average person passes gas about 15 to 20 times a day.
Oh.
So just know that if you feel like you're doing it more and that's in your number, you're probably in line with normal. I think it's healthy, and often it is great to talk about this.
My mom's a nurse and talks about farting all the time.
Yes, yes. And my grandmother's watching and hates that word, so I will stick to passing gas.
What was your last BM?
BM, yes. Every time I'm sick, my mother asks the same question. Growing up with moms like that is really important. Also, regular exercise, changing your diet, eating slowly. These are things you can do to decrease your flatulence, decrease your bloating.
It's not convenient this time of year.
It's definitely not.
I'm still taken aback.